One of the most promising developments in the field of Alzheimer's research is the recent trial of Donanemab, a drug that targets a modified form of amyloid beta, the protein that accumulates in the brain and causes damage to neurons. Donanemab is designed to bind to and clear away these amyloid plaques, which are thought to trigger a cascade of events that lead to cognitive decline and dementia. The trial, conducted by Eli Lilly and published in the New England Journal of Medicine, involved 257 patients with early symptomatic Alzheimer's disease who had both amyloid and tau deposits in their brains. Tau is another protein that forms abnormal tangles in the brain and is associated with neurodegeneration. The patients were randomly assigned to receive either Donanemab or a placebo intravenously every 4 weeks for up to 72 weeks. The primary outcome of the trial was the change from baseline in the score on the Integrated Alzheimer's Disease Rating Scale, IADRS, which measures both cognition and daily function. A lower score indicates greater impairment. The secondary outcomes included other scales that assess memory, language, orientation, reasoning, and activities of daily living, as well as brain scans that measure the levels of amyloid and tau. The results showed that Donanemab slowed the decline of cognition and function by 32% after 76 weeks, compared to placebo. The difference between the groups was 3.2 points on the IADRS scale, which was statistically significant but modest in magnitude. The results for most secondary outcomes were not substantially different between the groups, except for the brain scans, which showed that Donanemab reduced the amyloid plaque level by 85 centiloids and the global tau load by 0.01 more than placebo. These findings suggest that Donanemab can effectively lower the amyloid burden in the brain and slow down the progression of Alzheimer's disease in some people. However, there are still some limitations and challenges to consider. First, the trial was relatively small and short-term, so it is unclear whether the benefits of Donanemab would persist or increase over time. Second, the trial did not include a comparison group that received another amyloid-targeting drug, such as lecanemab or aducanumab, which have also shown positive results in other trials. Third, Donanemab was associated with some serious side effects, such as brain swelling or bleeding, mostly asymptomatic, which occurred in 27% of the patients who received it. Fourth, Donanemab did not seem to affect the tau pathology in the brain, which may also play a crucial role in Alzheimer's disease. Therefore, more research is needed to confirm the efficacy and safety of Donanemab in larger and longer trials, and to compare it with other potential treatments for Alzheimer's disease. Donanemab represents a hopeful step forward in the quest to find a cure for this devastating condition, but it is not a magic bullet.